we have to be the ones that kind of look at all of that and kind of reassess what we're doing on this planet and try to realize that we're only here for a short time. There's a lot of other groups of, animals and life and ecology and people that are going to inherit what we leave behind. And we're not doing a great job of leaving them much.
Without supplies, there's no surgery. Without products, there's no patient care. Welcome to Power Supply, the healthcare supply chain podcast focused on helping you navigate the intricacies of logistics, purchasing, contracting, and supplier relationships. Each episode, we speak with healthcare executives, supply chain leaders, and innovative entrepreneurs from across the country as they share their stories, experience, and expertise on the industry we love. From the loading dock to strategic sourcing, from buyers to the C-suite and across the enterprise, we tackle the real-life issues impacting the healthcare supply chain. Whether you're tuning in for conversation or inspiration, we're glad you're here. You're just in time to hear it from the source and stock up on insight. So sit back and plug into Power Supply.
On this episode of Power Supply, we speak with Scott Rich, Director of Growth and Marketing at Practice Green Health, and we're going to be talking about sustainability and driving change in that direction today, Hays. And Scott, nobody better than to come on and talk about it. We're going to get introduced to some concepts for some people, and others, their organizations may be well on their way to implementing lots of sustainability programs. But either way, I think you're going to find that Scott is not only passionate about what he does, but also incredibly engaging.
He's very engaging, actually. And I think everybody's going to learn something here, either out of the big picture or just a small practical thing that they can do to, today, tomorrow to get it started. But yeah, everybody hang on. I think you're really going to enjoy this.
We're going to be right back after a short break with Scott Rich, Director of Growth and Marketing at Practice Green Health.
I'm Hays Waldrop.
This is Garry Skinner.
And I'm Justin Poulin.
A production of 17 Studios, you're listening to Power Supply.
Joining us now is Scott Rich, Director of Growth and Marketing at Practice Green Health. And Scott, you and I had a chance to speak a little bit about Practice Green Health before you came on to do this podcast with us. And I really just love this conversation around sustainability. You hear it talked about all the time in supply chain and healthcare, and we have actually not had a focused conversation. It's come up as kind of another point in some of our previous dialogue, but never have we just spent an entire podcast talking about it. So I've been excited to have you on the show, and I want to welcome you today. Thanks for joining us.
Yeah, thanks for the invite. I'm excited to talk about it. It's definitely a passion of mine. I'm far from being an expert, but I'm really excited to share about my passions and my organization for sure.
You're quite the expert compared to me, so that ought to make you feel better.
That's always good. Any little bit helps.
Scott, why don't you tell us about your background? Bring us up to speed with what you've been doing in your professional life. And if you want to throw something in personal, a pastime, or something you enjoy doing on your free time, we'll take it as well.
Yeah, sounds good. Thank you. So I've been with Practice Green Health for just a little over 4 years. Our organization, as we'll probably get into later, is an association that works with hospitals and health systems on sustainability, specifically in healthcare, obviously. And before I joined the organization, I worked for a digital agency leading the climate strategy for Fortune 500 companies and their sustainability reporting, their corporate responsibility reporting, and building platforms, technical type stuff for that. And did a little, hang the old shingle out a little and do some consulting on my own as well. And then prior to that, just been involved with a lot of different nonprofits. I've had a passion for environmental sustainability in school and also just in my, personal time, donating time to, national and local organizations around nature and environmental stewardship.
Wow. Why don't you talk to us a little bit about what it was like to be in that consulting world too, because I think sometimes people out there listen to this and they have a lot of subject matter expertise and experience, but it's scary moving into a consulting role. And so I always like to share those kinds of intangibles maybe with people before we dive into the interview too.
Yeah, no, for sure. So doing your own side gig of consulting sounds glamorous and sounds fun. You kind of get to be your own boss, but that also means you kind of have to reprimand yourself too when you're not keeping up and project manage yourself. So that it is a lot of work. It's very fun because you get folks that come to you because they need your expertise. They need your help. And I think that part is really, it's both fun and it's also very meaningful because at the end of the day, when you finish a project, you realize you helped that organization out and you've definitely got that kind of plus delta with them, right? To know that you kind of helped them move the needle or provided them some added expertise. So that part can be really fun, but it can be challenging. You have to realize that it's a full-time job and it's a full-time job getting the new business too. If you want to keep doing that and hanging out your shingle. I was very fortunate and I have a lot of good, strong networks to kind of pull in. So if there were additional experts that I needed for a particular project, I had kind of that adjunct network, if you will, of friends and leaders to kind of help out. So it's fun, but it can be challenging.
Yeah, you can't be everything to everybody. That is such a key component to being out on your own, whether you're a consultant or just starting a new business. That networking part is so incredibly important to your success. I'm glad you mentioned that. How did you find Practice Green Health? And I can see just in talking with you previously that this is something that's probably very easy for you to get passionate about. So how did you find Green Health and why did it really strike your passion?
Yeah. So kind of in the midst of me kind of being that consultant for a little over a year after I left my previous gig and realizing, okay, I don't know if I want to be that consultant all the time, always out, talking to new clients, finding new clients, that sort of thing. I wanted to help an organization. I in my spare time, I work with a nonprofit. Practice Green Health is a nonprofit. And so that purpose-driven work and working with a nonprofit that was working with healthcare was something that appealed to me. I found, a listing on a nonprofit career site. And as I read the job description, it's one of those times that I think a lot of us have when you read a job description and a job announcement, and you're like, wow, that's me. Or if it's not me, I want that to be me. That sounds like a really cool job with a great organization. And, funny story with that, I actually missed the deadline. I was on vacation and I came back and it said the job had already closed. And I reached out to them and I said, hey, I know this job posting closed last week. But I said, I don't want to sound too cocky, but I said, I think I'm perfect for this role. And I would love the opportunity for you to consider my experience. And they did. Maybe being a small organization, they were able to do it, but they did. And that's kind of my great story for that it was actually closed. And I took a shot at wanting to throw my hat in the ring and they let me do it. And it turned out I got the job. So it was a good experience.
That's a story for everybody listening to this right now, right? Mm-hmm. Sometimes, timing's not right. The job, is closed, but it's not necessarily. So you keep knocking at the door. I tell that my boys all the time. So good job.
Yeah. And, I got feedback from one of our leaders too. They said the confidence was nice too. I wasn't cocky. I didn't say, you're not going to find anybody. I just said, hey, I think I'd be great. I think I've got all the skills you need. Let's talk. And they like that. And so I think everybody should think about that when they're thinking of roles, whether it's a volunteer role or a new job, is really believe in yourself and believe in your experience. If you're going to put your name down, on your resume and submit it to a company for consideration, let them know you're proud of who you are and your experience.
100%. You're right.
Yeah. And you hear all the time, don't take no for an answer. And it's built around that same level of drive and confidence. But this is a little bit different because sometimes we accept no when we weren't even given no. We take the opportunity off the table for ourselves. And that is a great story, Scott. You didn't limit yourself. You at least gave yourself the opportunity. And look, it landed you where you are today. So let's talk about sustainability. And you can put it in the context of the work that you're doing and at Practice Green Health as well. But what does this really mean? And specifically, what does it mean to you?
Yeah, sustainability, that's the thing today is, we often hear CSR, corporate social responsibility. Now we hear ESG, which is, environmental, social, and governance. Some companies talk about corporate citizenship. And it's basically all the same thing. Sustainability definitely has its own definition. To me, it is, balancing the resources we have on the planet with the resources that we're going to use. That's a real simple definition, but there's more that goes into it around equity and around justice and around just living as a global community, right? And I think we would all be better off if we could try to demystify all of that. And at the end of the day, it's about sharing resources and sharing our collective future on this planet. And it means that one organization or one person can't exploit or use all the resources, and that we really need to do a good job of being more efficient and thinking about communities and environments and ecologies that can't raise their hand and say this is wrong. The oceans can't raise their hand and say you're putting a ton of plastic in me. And so we have to be the ones that speak up for that. A species of animals can't raise their hoof, if you will, and say, help. There's 4 of us left. What's going on? We have to be the ones that kind of look at all of that and kind of reassess what we're doing on this planet and try to realize that we're only here for a short time. There's a lot of other groups of animals and life and ecology and people that are going to inherit what we leave behind. And we're not doing a great job of leaving them much.
Hey, Scott, I have a question, and along the same lines, I feel like we've made a lot of progress in this whole, area in the last several years. But I hosted a webinar the other day, and the guy was talking about supply chain, and he mentioned ESG, right? And so he talked a little bit about that. And I literally had 2 people after the fact call me and go, what in the world is ESG? They go, I've never heard this before. And when did that become, quote, a thing, right? And maybe could you give us just a little bit about that?
Yeah, I mean, I don't want to get tripped up in the tech, the technical definition of it, right? But it has its roots in socially responsible investing is where ESG really comes from. And I think the reason it's being talked about a little bit more now is because it's been brought up in for-profit corporations. So shareholders are saying, we have more things to consider here than just our profit. What is our risk that we have with the environment, with climate change? And so they're kind of leaning into that environmental, social, and governance piece, the ESG, to help the companies govern themselves and evaluate their risks. If you think about a company, being interested in shareholder value and profit, well, if you make T-shirts, right, or you're maybe a sportswear company and you use, cotton, and we kill all of the habitat for where cotton is, or sea level rise doesn't allow the, areas where cotton is grown to be grown anymore, then all those companies that use that as a raw material aren't going to be able to use it anymore. And so that means you're not going to make that revenue that you think. You're not going to have shareholder value. Gotcha. So I think that's where it comes from. We talk to hospitals all the time, and I always tell people hospitals and health systems in the US and around the world, but a lot in the US and Canada are probably 10 to 15 years behind other industry sectors when it comes to sustainability and climate change mitigation. They're just, figuring out recycling in some places and their carbon emissions maybe and renewable energy. And so then you throw in ESG and it just confuses people. So we really try to focus on demystifying it and focusing on the basics. What are the fundamentals you need to talk about? And, not to get ahead of myself, but with healthcare, it's even a little bit of an easier conversation because at the end of the day, hospitals are designed to keep us all healthy. And so they have it in their mission to do no harm. And that extends to the community. So what are they sending to the landfill? What are they sending out of their smokestack, so to speak, into the air? So gotcha. Yeah, that's how I define it a little bit.
Yeah, that was really good. And we are going to talk about those areas of opportunity in healthcare. And I like how you just said, I think there's building blocks here. You can be a very sophisticated organization, but if you're not, it can be overwhelming just getting off the ground. And so providing resources, let's start with the simple things. You can easily do this. And as you get organizational buy-in, you can start to create more complexity to that. I also appreciate you defining ESG because just like Hays said, they didn't even know what it was. So there might be people listening who didn't know what ESG stands for. But you also, as you were talking about what sustainability means to you, you threw out a couple of terms. And they're terms that people hear all the time, equity and justice. Can you define those in the context of sustainability for us, though?
Yeah, I think it goes, to balance and access and things like that. Like, equity when it comes to resources, it's what are the resources that we have? Are they being provided to everybody or for only people that can afford it? And so, the way that we steward resources and the way that we produce goods and services, those sort of things, I think you have to keep that balance there. We can get into the kind of the healthcare side of it a little bit, down the line, and that's not necessarily my expertise, but just, equity sometimes in that context, it means things around access to healthcare. So thinking of communities of color, thinking of communities that don't have access to healthcare, rural communities that it takes an hour to get to a hospital. So equity can kind of cover a lot of different areas.
So what about justice? Is that kind of what you were describing when you said, this particular animal can't raise their hoof? And so, have to create a sense of justice. I loved that, by the way.
That's in my brain right now.
It is in my brain.
Yeah. I mean, I think there's justice for that, but also, justice in general around who gets healthcare, who gets access to things. It also goes to, when you think of ESG, a lot of boards of directors are thinking, who are the decision makers that are representing these communities? And so looking at diversity, equity and inclusion, DEI is a big topic right now, and it really speaks to justice. And then, really going back to that access for healthcare, there's a lot of people in this country, and we found that out during the pandemic, that don't have access to healthcare. I always talk about my privilege a lot around, when the pandemic happened. I'm like, I have a job, I have access to healthcare, I've got access to testing and all that. But we know there's a lot of people out there that don't, because they don't have access to news. They don't have access to the media, possibly. They don't have insurance. They might have gotten laid off. So I think we have to think about justice in a more broader context for all of this.
Got a question here for you, Scott. I'm just, if I'm a 200-bed hospital in the middle of Nebraska and you show up, what are the first things that you could look at? What's the low-hanging fruit for you, for this hospital to do, to become better, more green?
Yeah, it's always a good question that we kind of face every day at Practice Green Health. Usually what we start with is kind of extending the metaphor to not just the low-hanging fruit, but what's the fruit already on the ground? What can you bend over and pick up? There's a lot of obvious things out there. And I always try to, tell hospitals, and the rest of the experts that my organization do, is one, tell them first not to be hard on themselves. Hospitals and health systems are complicated organizations, right? It's one of the few places that has 7, 8, 9 different types of waste streams to manage that are all highly regulated. They have to be on 24/7. They have to have an operating room ready to go at a moment's notice. So they've got a lot of complexity to them. And I think what we're finding is, hospitals that are at least raising their hand and saying, how can you help us? We'd like to at least start there and find out what's your focus? Why did you call us? Why are you interested in this work? So first, kind of find out what their motivation is and why they're interested in the work. A lot of times it's because it's from a grassroots perspective. The hospital might be having some employees or maybe the community wanting them to be more community minded and environmental stewards, so to speak. But I think, to get back to your question a little more specifically, I think it's, we really try to start with an assessment of where they are and do some baseline measurement of where they are currently. So that might involve some data collection, but really saying, what do you do now? Do you recycle or not? Do you have vendors that can help you recycle or not? I got an email, I don't know, probably a year or so ago from a hospital in rural Indiana, and they wanted to do a lot of work, but they're like, we don't have any vendors that will take our cardboard and our recyclables anywhere. So we're stuck with it. So it either just piles up or it goes to the landfill. And it was like a cry for help almost. So I think,
right,
it's not just the hospitals. I think government needs to help more. I think the healthcare supply chain needs to help more and come up with some strategies to help. Not one entity can do it all on their own. We all have to work together with this. And I think that's, big movements like the Race to Zero or the COP, events that happen around the globe to deal with this. I think it's trying to shine a light that we all have to work more efficiently together to tackle all this work.
You got introduced to us through somebody in healthcare who is a past guest and was also, I think they might be outgoing now as the education chair for ARM. And because you were just talking about doing this assessment and sort of trying to understand where they're at and identify those opportunities, what are some common ones? If anybody is listening to this, maybe they're in that same place as the Indiana hospital that you just described. Maybe they're a little bit further along, but as you do those assessments, what are some areas that you're just like see over and over and over, and especially as it relates to supply chain?
Mm-hmm. Yeah, I'll start off with the G in ESG, the governance part, and what we like to call sustainability fundamentals. We first start with just looking like how they're organized. You can have a project like a recycling project, but if you don't have leadership involved, if you don't have an executive sponsor to help you out with this work and kind of help validate that work and also hold you accountable for that work, it's not going to go very far. It's just going to be a little project. You're going to have some success or not, and then you're going to move on to your next project. And maybe that's changing light bulbs, or maybe that's getting some chemicals of concern out of your environmental or housekeeping supplies, things like that. But I think having some leadership buy-in is really important. So we really look to what's your governance structure? How are you organized? Do you have a green team or a sustainability committee? Do you have an environmental charter? Is it aligned with the mission of the hospital? So starting there is a really, really important part of that assessment of seeing where a hospital or health system is. So that's the first part. The second, part, and this isn't really in any sort of order, is, relying on the hospital or health system's vendors and partners. They all collect waste. They all monitor their energy. They all measure their water and their other utilities. So getting them to help as far as calculating all that and providing that information and that data to really see where they are. Practice Green Health, one of our hallmark programs is we have an Environmental Excellence Award program. And part of that program is a data collection tool where we actually get a ton of data from our hospital and health system partners, not only so we can see what they're doing to recognize them for their successes, but also help them, manage what they're measuring and seeing where they are. And inherent in that is a baseline for the current energy that they're using, the water that they're currently using. So what are all of their environmental footprints? And then taking some steps to try to reduce those where they can. So kind of baby steps is kind of how we approach it, because we know that there's some limitations, and also there's probably some education that needs to happen. There's some partnerships that need to happen.
As I work with strategic sourcing, it gets divided up into clinical and non-clinical. So in that clinical area, like the operating room or endoscopy, what are some of the more obvious opportunities in the clinical setting? And then I would ask the same question for non-clinical.
Again, not being the expert 100% here, but I'll give everybody a little bit of a flavor. I'll talk a little bit about the operating suite. We have a program called Greening the Operating Room. It's been one of our hallmark programs for over a decade. And in settings like that, one area that our partners usually go to is energy management. One strategy is called HVAC setback. So basically putting a Nest, to use a brand name, I guess, a Nest thermostat in the operating rooms. And so regulating that HVAC, the temperature control in the operating rooms, and also doing a little bit of organization around, well, if we have 17 operating room suites, they don't all need to be on right now. Maybe we only need to have 2 on over the weekend, or from, 1 in the morning until 4 a.m. until we get ready to do cases the next day. So there's a surprising amount of energy that can be saved by turning things off. We've got case study after case study of hospitals and health systems and medical office buildings even that do a computer shut off. Most of us just let our computers go to sleep, but there's actually a ton of energy savings that can be done if you actually shut off all the computers. So things like that, I think evaluating those low-hanging fruit or those small wins. There can be fluid management programs that are in the operating suite that save water. One area of focus, and it's not as much on the energy management side, but it's around greenhouse gases, is anesthetic gases. So, when we go in for surgery and the anesthesiologist, puts us to sleep and gives us the good gas, there's different types of anesthetic gases, and anesthetic gases are greenhouse gases. And just by switching to a different type of anesthetic gas that puts us to sleep pretty much the same way, a hospital can reduce their greenhouse gas emissions just by that switch. So a lot of times it's just education. It's thinking outside the box. It's building partnerships. It's getting clinical champions in the operating room that can really make a difference when we're making really smart changes and introducing environmentally preferred products.
Scott, so many of the things you talk about, and frankly, so many of the things we talk about on this podcast, it all goes back to leadership at the hospital system. You have to have somebody who can drive this change, who really embraces the change and wanting to do it. So is there one particular person that you would always say, that's the guy, that's the lady, that's the person that we need to see? And the other piece of that is how important, as they try to spread that news, do y'all have an award system or something that actually these people can be recognized for their good deeds, if you will?
Yeah, great question, Hays. I think the leaders at an institution, I don't think we have one particular title, that is the right person to shepherd this work or to lead this work. It kind of depends. As you guys probably know, there's a whole different ways that hospitals and health systems are organized, right? Some of them are really centralized. Some of them, it's kind of, they might have a regional approach. So especially some of the faith-based hospitals, they have what they call kind of their ministry approach, right? Where they've got little clusters all over and they are regionalized that way. So they might have leadership there that champions the work. I think at the end of the day, any leader in any capacity that has some decision-making ability, that has the access to the C-suite, might even be the C-suite, but access to leadership and maybe even the boards, those are the ones that I think are the best to be able to have that role as not only a leader, but setting a good example. And also that person has to be ready to be on the accountability side too. Because in order to do this work, you also have to set goals. You have to set targets. And so what happens if you don't meet those targets? Then we have to be accountable for not only the work that's getting done to mitigate all that, but also to recognize when we didn't measure up as much. And so what are we going to do from there? The rest of the world, I think outside of healthcare, and it's not every industry sector, but a lot of sectors are tying executive compensation to sustainability performance. And I think that's eventually where we want to go. We really need to get there. And you might have to refresh me on kind of the second part of your question, Hays. I know I was focusing a little more on the leadership part.
You did a great job on that, obviously. But I know y'all have a really robust awards requirements. How does that impact people, calling and that recognition, I would think would obviously help, move it along inside of a system? Yeah,
thanks. So our environmental awards program that we have mainly recognizes the program or the efforts of the hospital generally, not really focusing on one person. And, I always like to think that true leaders don't really need the recognition. So I don't think it's as much about recognizing a leader per se for doing what he's supposed to do, he or she are supposed to do for leadership. We do have recognition for leaders like lifetime achievement type things. And we do recognize leaders of hospital systems or just in general, the healthcare sector in general, we do. But we really try to focus on the hospitals themselves, the folks that are actually doing the work. And then I like to, focus our work too on how does that hospital then get that news out? How do they celebrate that victory? How do they message that to the rest of the employees in the hospital and to the community? Because that's where the big deficit is. I don't think there's a huge deficit in recognizing an individual leader. There's more about sharing that message about their sustainability success and why they're doing it and tying it to the mission of the hospital and the community.
Exactly. It's a great PR piece as well. It really ties in well, doing the right thing, and it's a really good thing for the community.
All right. So as we wrap up the interview, it always flies by. Scott, I want you to tell me, what's this all going to look like in 5-10 years? Especially as more of like, if you had your way, if it all went the way you hoped it would, what it look like?
Well, in healthcare, I think if it goes the way that I would like it to, every single hospital or health system would have a full-time employee dedicated to sustainability. Right now, we've got employees that are, say, a facilities director or a VP of support services, and they're all good leaders, but they also wear 10 other hats. So you need a dedicated employee to these efforts is just too much to focus on. And a real holistic sustainability program covers so many different areas. Practice Green Health focuses on 11 impact areas. And when you throw in the complexity of hospital operations, I think you need one person to do that and more. I think there needs to be visibility in the C-suite for sure. I think it needs to be tied to employee compensation, especially leader compensation. I think that would be big. And I think every single hospital and health system needs to establish carbon targets for themselves, for their organization. How are they going to play a role in reducing our global carbon footprint? Healthcare is one of the largest emitters of carbon on the planet, and we need to do our part to reduce that. So I think everybody needs to do that. For me personally, as the director of growth for Practice Green Health, we currently have about 25% of hospitals in the US in the Practice Green Health network. I'd love to see that be 100%. That's not going to happen in 5 years, but we're growing at a great pace. And it's because hospitals and health systems know they need to do this work and they need the help. So that's probably on my wish list of what I would see success, at least the trajectory of what success looks like.
All right. I have one follow-up question to that before we close. Just considering the workforce, labor shortage, et cetera, and I'm not even sure what kind of training would be behind that. So let's say a hospital is going to put somebody in that dedicated role. Are there people out there already waiting to fill those positions? Or are they going to need a lot of training? And how would that happen?
Yeah, I think there probably are some people out there that have this training, but I also don't think you need to have an MBA with an emphasis in sustainability. That's really helpful and it'll make you probably more successful. But a colleague of mine several years ago who worked for an energy company here outside of Portland, Oregon, when I asked her how she got her role in sustainability, she said there wasn't a place. There wasn't a sustainability job. And she said, I just started focusing on things that were passionate to me. And we slowly built a green team. And then we slowly built the program, and then leadership recognized we needed a sustainability role. So I think a lot of times it can start with passion and the desire to do it. I think from a talent management perspective, the organization, the hospital, the health systems need to realize that the employees that work there want this work to be done. Healthcare is a sector that is driven by dedicated employees that care about other people. But I think deep down, they also care about the planet too. And as we all know, with all the different millennial surveys that there are out there, millennials and the generation to come after, they want to work for a place that cares. They want to work for a place that has a level of citizenship about their work. They want to work somewhere that they care. And mission, exactly. So I think it's incumbent upon those institutions to recognize that. But yeah, that's I guess kind of my thinking on that.
And Scott, I'd have one question. We hear and read things on the news from the political standpoint about we're going to do these great green ideas and these things, and some of them cost a tremendous amount of money, and other things are huge, massive inconvenience for the way we've always done it. But in general, are some of these programs that you would institute at a regular hospital, do they cost a lot of money, or can they actually save money for the system?
Yeah, that's a great question, Hays. That's always the conundrum, right? Is like, it costs money to make money or costs money to save money. To be quite honest, when I first started this role and started making presentations to hospitals and health systems, we would lead with a lot of cost saving stories. Like, if you implement this strategy, XYZ hospital was able to save, $45,000 a year. But lately, this conversation has switched a little, and we've heard when I've continued to make that pitch and share the benefits of joining Practice Green Health and doing this work, I've had some leaders say, "Yeah, we understand. There's going to be some that we're not going to, have an ROI on our investment here, but at the end of the day, this is the right thing to do, and we need to do it." That's a shift, and I think that's something that is worth mentioning. But I think with anything, there's a level of investment for some of this work. You have to do that and look at really the long-term payoff. And also just think of in general, when it comes to certain resources that we have a finite amount of it. So it makes sense to try to think of other strategies. If you guys will indulge me for just a couple more seconds. I had a good buddy from college. He and I were debating back and forth one day, probably on Facebook. That's the place where everybody gets in fights. And we were talking about climate change and sustainability. And he knew kind of the space I was in. And I said, well, let's just hop on the phone. So we got on the phone and we started talking. And he's like, I'm just not sure if I believe in climate change or believe that it's man-made. And I said, that's okay. Let's just talk. I said, in general, though, don't you think it makes sense to conserve our resources and not dump a bunch of plastic in the ocean. So when you go to the beach, luckily he lived in San Diego, so he could relate to the beach analogy. But I said, so stuff isn't washing up on the beach. Don't you think it's better that we, have other ways to provide power for our country and for the planet? And he's like, yeah, I agree with that. And I said, well, if you boil it down, that's really what sustainability is all about. Like, you can get mired in the politics, you can get mired in the extreme cases, but at the end of the day, almost everybody understands that sustainability is actually really good for business, and it actually helps companies on their bottom line.
You just closed this interview with amazing grace. That was awesome. Drop the hammer. Scott, really, really nice job. I like the way you just put that in real practical terms. I think everybody can get behind that. And I wish you continued success. And I want to tell you how much I appreciate you spending some time with us today.
Yeah, well, thank you guys for the invitation. Always glad to share this. Like I said at the outset, it's a passion of mine, and it's an area I think everybody needs to think a little bit more about.
That was Scott Rich, Director of Growth and Marketing at Practice Green Health. And I do want to mention that they recently rolled out a program. So there's lots of resources on the website, but they have a sustainable procurement program. So specific to this audience, I think that's a good resource, something you might want to check out. And a conference as well, but by the time this airs, it's going to be about a week before it goes, but CleanMed. So I think that's like May 10th through the 14th. So doing a lot of good things to educate healthcare out there around sustainability. And honestly, Hays, I just loved the passion and the way that Scott was able to explain some concepts to us and identify some easy opportunities that are out there for the taking in healthcare.
Yeah, he absolutely did. I thought he did a good job because he made kind of the complex simple. And he also just said, you know what? We all should care about this, regardless of what side you're on. It's important. I mean, who doesn't want to, have a better environment? So I thought he did a really good job about breaking that down. So yeah, I learned a lot, and that's a really good organization for sure.
All right, well, that's going to do it for this week's episode. As a reminder, you can support Power Supply by subscribing on Apple, Amazon, or Google Podcasts. We're also available on Stitcher, iHeartRadio, Spotify, or just search for Power Supply on your favorite podcast application. But we've got bonus content if you download our smartphone app, so make sure you do that. And while you're there, we'd certainly appreciate a rating and a review because your feedback is important to the show. On behalf of Hays and not Garry today, this is Justin Poulin. Thank you for listening to this week's episode of Power Supply.